Hello, my name is Ileana Padilla Boyd, and I'm a state certified teacher in the state of Florida. I'm also the owner of Bright Starts Educational Services. Let's talk a little bit about how to identify learning disabilities in your child or a student of yours. A couple of things that you need to look for. First of all, does your child have poor organizational skills? Does your child get confused at times with what time really is, like today, tomorrow, yesterday? Also, does your child get confused when maybe looking at letters or words? These are some of the symptoms, not diagnoses, but symptoms and red flags that could help a parent identify a problem with their child's learning ability. Overactiveness is also one of them. Another one might be that they might confuse the names of their best friends. Well, if you notice this in your child or again your student, you may want to seek professional help from possibly a child psychologist, someone that could give them the correct testing, that can give them the time that they need to come up with a diagnosis and to put the parent and or the teacher at ease.
This is the National Institute for Children's Health Quality Vanderbilt Assessment Scale. It's used for diagnosing ADHD. There's a part for a parent informant. You just answer the questions. 0 for never, 1 occasionally, 2 often, and 3 very often. And this should be considered in the context of what is appropriate for the age of your child. When completing this form, please think about your child's behaviors in the past 6 months. And also, at the time of the evaluation, is a child on medication, not on medication, or not sure? And then for office use only, they would tally it up and give you a score. The teacher is also given a form with same kind of questions, same directions, and the evaluation based on medication, not medication, or not sure. And then usually that gets returned to the pediatrician or physician that's monitoring your child. And then they give you the scoring instructions for the Vanderbilt Assessment Scale. If you read through it, it's pretty self-explanatory. They'll look at the Parent Assessment Scale, and you can be predominantly inattentive subtype, ADHD combined inattention and hyperactivity, oppositional and defiant disorder, conduct disorder, or anxiety depression. For the Teacher Assessment Scale, it's predominantly inattentive subtype, predominantly hyperactive impulsive subtype, ADHD combined inattentive hyperactivity, oppositional defiant conduct disorders, or the anxiety depression as well. So the parent and teacher follow-up scales have the first 18 core ADHD symptoms, not the comorbid symptoms. This segment has the same performance items and impairment assessment as the initial scales. Scoring the follow-up scales involves only calculating a total symptom score for items 1 through 18. that can be tracked over time, and the average of the performance items answered as measures of improvement over time with treatment. So you would calculate the total symptom score for questions 1 through 18, and calculate average performance score for questions 19 through 26. That's for the parent as well as the teacher assessment. And like I said, these scores will all go to your pediatrician or your physician looking after your child. You'll sit down, go over the scores, and come up with your action plan.